So we are beginning with the lecture series on SIRS, sepsis, mods, severe sepsis, septic syndromes, shock, and so on. So let's begin with the SIRS. What is SIRS? SIRS is the systemic inflammatory response syndrome and is defined when two or more of the criteria are met. The criteria which are used are four in number, which includes temperature, respiratory rate, heart rate, and white blood cell count. The temperature, if less than 36 degrees centigrade or greater than 38 degrees centigrade, is one of the criteria. Respiratory rate 20 breaths per minute or PaCO2, partial pressure of carbon dioxide less than 4.3 kilopascal, heart rate greater than 90 beats per minute, white blood cell count less than 4 or greater than 12, or 10 greater than 10% of immature neutrophils. These four criteria, if two of these are found, are considered positive for SIRS, and a diagnosis of SIRS can be made. This SIRS is basically is the result of progression of inflammation throughout body, which principally occurs hematogenously and finally results in SIRS. The causes of SIRS can be considered as triggers, and they can be classified further as being infective or non-infective. If we divide them systematically according to the organ they affect, so in the cardiovascular system there are infective and non-infective causes. We will be taking one example for each organ to make this video concise and to equip you with the knowledge required. In cardiovascular system, the non-infective cause is ruptured abdominal aortic aneurysm or major hemorrhage. The infective cause can be centralized colonization. In the gastrointestinal tract, the non-infective cause can be pancreatitis. Infective cause in gastrointestinal tract can be bowel anastomotic leak. In genitourinary system, acute tubular necrosis can be the non-infective cause, and UTI is the leading cause of infective SIRS by genitourinary system. In respiratory system, aspiration pneumonia makes the non-infective cause, and lower respiratory tract infection makes the infective cause. In soft tissues, embolus formation leading to ischemia is the non-infective cause of SIRS, while necrotizing fasciitis makes the infective cause. And if we consider generally, burns and trauma are the non-infective causes of SIRS, while sepsis being the infective cause. The most common triggers of all we discussed are pancreatitis, burns and trauma, sepsis, ruptured abdominal aortic aneurysm, and major hemorrhage. Now, these all causes of SIRS are considered as triggers. What do they result in? A trigger usually results in an over-exaggerated, progressively increasing inflammatory response, which is mediated by, of course, by release of cytokines, mediators, and vasoactive agents, which includes bradykinin, histamine, nitric oxide, and prostaglandins. These cytokines, mediators, and vasoactive substances these are distributed systematically throughout the body, which results in vasodilation, increased vascular permeability, and features of SIRS. And finally, organ failure may ensue. So, the pathogenesis in development of SIRS is trigger of progressive inflammatory response leading to release of cytokines, mediators, and vasoactive agents. Finally, vasodilation and organ failure, which may ensue. There are pro-inflammatory and anti-inflammatory cytokines. The pro-inflammatory cytokines are interleukin 1, interleukin 6, tumor necrosis factor alpha, interleukin 8, and platelet activating factor. The response of SIRS is kept in control by pro and anti-inflammatory cytokines. If there are more pro-inflammatory cytokines, the response would be higher. If there are more anti-inflammatory cytokines, the response would be low. The anti-inflammatory cytokines are interleukin 10 and transforming growth factor beta. SIRS, if left untreated, can proceed to sepsis, which we will be discussing in our next video.